been in the healthcare side of business side of healthcare, I should say, for over 20 years. I am a practice administrator of a large local OBGYN practice, where I have been for the past 12. Although I'm not a proponent for a public plan or universal healthcare or Canadian health plan, I do have major concerns. In the last 5 years, I have seen our Medicare, our Medicaid, and private pay, which is often no pay, because everyone has a high deductible that people cannot afford, grow to 30% of our practice. My practice is in this local area, so it's in one of the more affluent areas of the city. Some have 100%. So we have 30% that are already in the public plan, which is pretty amazing since 1 out of every 2 babies born in San Antonio are in Medicaid. I don't know if y'all realize that. 1 out of every 2 babies is in Medicaid, okay?
How many of those?
So we already have a public plan. Okay. My biggest fear is not a public plan or a not-for-profit co-op, but my biggest fear is not doing anything at all. Why hasn't anyone addressed the inherently flawed business model of the insurance companies? They are set up as publicly traded companies that are beholden not to the patients, as their ads might have you believe, but to their shareholders, which they have, in order to make a profit, they have to raise their premiums, and so they increase their revenues, and they have to lower their payment, their costs, which is decreasing payments to hospitals and to doctors and denying needed medical care. Our own experience this year, I just finished this. As an employer, I have to get 200 employees health insurance. They gave us, and one of the large groups, starts with an H, gave us a proposal of a 32% increase in our premiums. At the same time, they come as a provider and ask us to take a 10% decrease. Now, how am I supposed to run my business like that?
Okay. Amen.
A lot of good points were just raised. Let me respond real quickly to at least, I thought, 3 different ones there. You're absolutely right. We need to fix the system. I've talked about that, and I do think that there is bipartisan support to fix the current system, not necessarily take over the system. On the insurance company, they provide a public service. Now, when you talk about premiums going up, if you want the premiums to go down, let's pass tort reform. That will help the situation as well. On the other hand, last time, as I mentioned a few minutes ago, there can be more competition. Some states only have 2 insurance companies. In fact, 6 or 7 states only have 2 insurance companies providing all the insurance policies available. That strikes me as not really competitive. So that's why I'd like to open it up to say to any individual, you can go to any state, get the best deal you can, get the lowest premium you can, get the kind of health care insurance that you want, not be told what to get by the government. So thank you for your time. Yeah.
In Obama's plan, Congress is exempt. In the Republican plan, are you also exempt from your?
The question was in President Obama's health care proposal, Congress is exempt and doesn't have the health care plan applied to them. And the question was in the Republican plan, are we exempt? The Republican plan doesn't have a public option or a government mandate, so it's a moot point on the Republican side. Now, here's something that's interesting that I think is very, very clever. During the consideration of H.R. 3200 by the Energy and Commerce Committee in the House, an amendment was offered to make the health care plan mandatory for members of Congress. That was an amendment I would have supported, but was defeated on a straight line party vote.
Imagine that.
Just wanted to make a quick announcement. We have 2